double chevrons forward, and this will turn the camera on just like the Omni camera. But now, as you can see if I wiggle it, we still have the lower jaw, upper jaw, and buccal bite, just like we've done before. And there's two ways to do the camera. One way is automatically, and the other way is manual. And I'm going to show you both methods. We'll do both the automatic and the manual. Before I actually give the demonstration on the camera, we need to talk a little bit about powdering. Powdering is a little bit challenging when you first start. It has to be extremely dry. You must maintain moisture control and keep the patient's tongue and lips off of it after you've started to powder. So you're going to start with a very dry surface and then keep it dry as you're powdering. I want to show this little bit of a video. Most people, when they start using the blue spray, they way overuse it. This is an example of way too much spray. You should be able to get 16 to 17 restorations out of one can. The teeth actually are not supposed to look blue like this model. All you're really supposed to do is give a light dusting. I'd rather have you do the spritz method. As you can see, you're holding it about 10 millimeters away. Shake the can every once in a while. Give it a short blast and move. So you're just a little short spritz. And then once it's finished, it should just look very lightly powdered with no gloss. The camera may be used in either automatic mode or in manual mode. I'm going to demonstrate both. The manual mode is what I would like you to start with, especially on your preparation side, at least until you're used to it and can get a good feel for the camera. I don't encourage you to stay with the manual mode for very long, but just to learn how the camera is used, how to line it up properly, manual mode is probably the better choice. To get to manual mode, you're going to put your cursor over the camera, and then if you just click the foot pedal, which is the gray foot pedal on the floor, or the left click button, you can see it turns the camera on. This is automatic mode because there's a blue crosshairs. You see the blue crosshair here? That means you're in automatic mode. It won't take a picture unless there's a proper amount of powder and you're not moving. To go to manual mode, you have to have your cursor on the camera, and then you're either going to lift the gray pedal in the front with your foot, or your assistant is going to hold the left click button down. And when you do that, you now see that the crosshairs have turned green, and that means that as soon as I either let go with my foot, which is the upward action, or left drop the left click button, it's going to take a picture. As you can see, it took a picture of the heater and captured it into the catalog on the right hand side. If I wanted to take another picture, I have to have the cursor over the camera. I could left click and hold, and then let's say I wanted to move the camera just slightly over here, and if I drop the camera or drop my foot or let go of the left click button, it takes another picture and attempts to add it to the existing picture. So that's how we're going to do it in manual mode. Automatic mode will take them and save them automatically. One of the reasons that you have to be careful is that sometimes it'll take it before you're ready. So we're going to demonstrate that in just a moment. Now going to demonstrate the blue camera, and this is going to be manual mode. You're going to either lift with your foot or left click and hold, and that's going to turn the camera on. As you can see, it has the green crosshairs, which means this is in manual mode, so it's not taking any pictures. What I like about manual mode as you first learn to use this is you can set the camera down on the most posterior tooth, and then pitch and roll your camera until you can see all the margins. You have to be very careful with this. This is, as you can see, a difficult margin. I want to be able to see both margins. If I tilt the camera too much, I lose the distal margin. If I tilt it in the air, if I tilt it forward, I lose the mesial margin. If I roll or move the camera, we must be able to see all the margins on every single picture. Once you are sure you can see the margins, you're going to drop your foot or left mouse button. Then you're going to lift your foot again. As you can see, I stayed in the same spot. I didn't move my hand. Now I'm going to lift my hand up, go distal, and I'm going to overlap by about 1/3. Try to keeping the cursors in the same distance. I'm also, if you notice, looking at to make sure I can see that margin on the distal. I drop my foot and I wait to make sure that it develops part of the model on the right hand side. Lift my foot again. We're in the same spot. I now lift up, come forward, set down, and I'm going to now tilt the camera. As you can see, if I take a picture like this, I'm going to hide the margin. So I'm going to tilt the camera up so I can see the margin, and then drop my foot. I'm waiting to make sure it adds. Then I'm going to left click. I'm now going to make a little bit of a mistake. I'm going to go a little too far forward, so it's not going to have enough information to string these pictures together. As you can see on the bottom right side of the screen here, that this turned red. In order to get to this, all you have to do are click these little buttons on the bottom. Okay, so I can click this button and it'll show it. I can also just pull my cursor to the bottom of the screen and it lifts it open. Now, as you can see, I've got a red box around this. Does not mean I have a bad picture. What this means, it just cannot stitch it together. And if I look at my model in this area, I can see that I have a good picture of the first molar, or first bicuspid, excuse me, but I don't have enough here information for it to find it again. So I'm just going to go back, lift my foot one more time, and this time I'm going to overlap by about 1/3, make sure I don't hide the margin, and then drop my camera. And as you can see, it now puts these two pictures together. The last picture I'm going to take is a buckle roll, and that's to help with the buckle bite. Make sure that you don't, again, see how I'm picking up a piece of the margin? I don't want to hide that. And also, you notice at the top of the screen there is a little bit of powder on the lens. That really doesn't matter anymore. So once we drop our foot, that gives us the roll picture. Now, what I also want to do is show you what happens with the manual mode. Notice how this section has all of these artifacts in it. In order to judge why this happened, I can go down and individually examine all these photographs. Photo number 1 is fine, photo number 2 is fine, photo number 3 is fine, 4 is fine, 5 is fine. Now, the problem with this photo is that we had a lot of shake, and shake makes it look like this snakeskin appearance. In order to remove that, I can either left click and drag it to the trash, or I personally just like to right click and it takes it out of the equation. You notice how it cleaned that model up? I'm going to right click again. Now you can see I can put that in and out. Now the next picture is the same thing. It has that mappy look to it. It's got a lot of shake. I'm going to right click on it to get rid of it, and now it's cleaned up. So that's how we're going to do this in manual mode. Now the good news with manual mode is it gives you a chance to position the camera so you know what you're taking a picture of. The problem is, as you saw, it also allows you to shake. And if you're under powdered, it will take a picture. We're going to force this camera to take the pictures. If it's in automatic mode, it won't take a picture if it's under powdered, and it won't take a picture if you're shaking, if there's any movement. So that's why I'd like you to get to the automatic mode as soon as you can. So now I'm going to demonstrate the upper jaw we're going to do in automatic mode. So I'm going to go here, click upper jaw to tell it I'm working on the upper jaw. I'm going to click on the camera. As you see, we've got the blue arrow, which means it is in automatic mode. Now when we go, all we do is hover above our restoration. Hover above the restoration. Once we're happy with where it's located, set it down and then lift as soon as you hear the click. Okay, then I'm going to come forward, set it down, and as soon as it clicks, move forward. So I'm going to set it, it clicked, I lift up. Okay, it didn't add together. It says overlap is too small. So I'm just going to go back, take another picture, and now they all string together. Now one of the issues with this camera is that if I set it down and don't move it, watch what will happen. You can see it just continually takes pictures, and it's just taking the same picture over and over again. Now I want to get a buckle roll, so I'm going to roll it, and now we're going to go and evaluate these pictures. I'll shut the camera off. I'm going to look at picture number 1, it's great. Picture number 2 is great. Picture 3 is great. Here's 4. And if you look, as we're taking these pictures, in this area, wherever it's white, that's where the camera is. So you can see that picture is in that location. And if I look, I say, well, maybe I don't need those because they're the same. Notice I right-clicked, and it tells it not to include that in the image. The thing with this camera is the more images you take, it averages things together, and it actually decreases the accuracy. So try to keep this to as few pictures as possible to get your information. I'm going to go in maybe this one. Maybe I don't need it. I right click, I didn't need it. Oh yes I did. See how all of a sudden I've lost important information? So I'm going to put that picture back in and build the model back together. Okay, now as we go forward, I'm going to delete this picture because these are where the camera was taking multiple shots of the exact same thing. So there's really no reason to have these involved. I'll remove that. The last one is the buckle roll. And it's very important you get the buckle roll because you're going to match the buckle bite, as we said before, off of the mainly gingival tissues. Now I'm going to do the buccal bite. And on the buccal bite, I would suggest that you do the buccal bite manually, especially in the mouth, because if you try to push your camera against gingival tissues with that camera protector on it, it's going to cause some issues with your patients. It'll be very uncomfortable for them, so they may move on you. So what I'm going to do, I'm going to turn the camera on manual mode. You can see I've wiped off just a little bit of the powder. It should not have an effect. I don't want to take a picture where the prep is, so I'm going to come forward of it. I'm going to set my camera down so I'm looking like a bite wing. I'm trying to look interproximal. So I want to center it, and then I'm going to roll up, get gingival tissues, and drop my foot. I'm going to left click again, or lift my foot, and go directly above it. Now you can see the first two pictures I took is what it's trying to match. So I'm going to right click to get rid of those two. And now I can also see that the last picture did not match. So what I'm going to do is I'm going to turn the camera back on by going to the camera icon. set the camera so it gets a little more overlap, and then drop my foot. As you can see, it now has all the pictures that we need. And I may not need this middle one, so I might just erase it, but now I'm thinking, well, I really like that it has that other bicuspid, so I'm going to put it back in. So here we have the bites, and from this point it's the same software, so it's going to look identical to the blue camera where we left off with this demonstration. So I'm going to go next, and we're going to go to the same section where we're going to match the buccal bites, and then we'll continue on with the designs of the restoration. As you can see, it's creating the virtual models. It's doing the lower jaw first, and then it'll do the upper jaw. And again, this takes a few minutes of your time. Okay, and again, we're going to place the model so we can put just the bicuspid and cuspid area. Same situation that if we attempt to put this, I grab it on the bottom and carry it to the top, you can see it flips over. So this is the same as with the Omni camera. I'm going to pull it down, drop it together, and once that connects, I'm going to take and pull it to the upper jaw. Remember, you always have to take the gray to the model, and once it goes in and matches, as you can see, we're going to go to the analyzing tool, and then we're going to hit model contacts. This is a very important step for both cameras. We're going to hit model contact, and it's going to show us where this tooth or this arch is hitting. So you want to make sure that this arch is hitting in the same spot as it is in the mouth. Now from this portion on, both cameras are going to work the same. Okay, because the software is identical. One will be in color, one will be stone model. That's only going to be the only difference.